So we are solving real problems. As you saw with Maria, you heard us discussing, we believe that closing care gaps effectively is paramount for everyone involved. We're incredibly passionate about optimizing this process, operations. So very, very passionate about that. Our dedication to improving patient outcomes is fueled by a robust data-driven approach. We focus on operational excellence and delivering personalized and focused approach, which truly makes a difference. This translates into more efficient provider engagement and, most importantly, healthier lives for patients. One thing I always like to mention is that we don't want to just bother a provider if it's unnecessary. That's why it's so important to review the data thoroughly prior to those connections and really come in with an approach that is not just, hey, can we sit and chat about all of these and review them all together, but here are some things that we noticed and have a very clear and determined approach. The coordination with the coding, like the exclusions or the pharmacy records, as Kate mentioned, and appropriate documentation in the patient chart. Those are all things we go over with the care teams as well when we're in communication with them. We have some of the best conversations and touch points with the care teams. They truly care about their patients as well, and they genuinely are trying to do the best that they can with what they have. And again, administrative burden. We all know this. We'll say it a million times, but it is a lot sometimes. And just having another person come in and say, here's what we noticed. Could you verify this? Let's walk through it all before we reach the provider and just ensure that this patient list is correct and that they should be talking, the cardiologist and the provider should be talking about these particular patients. We also form relationships and we follow up with these organizations and clients and clinics that we all that we form or have those touch points with. And we genuinely enjoy talking with so many of them, and it becomes really personal for our team as well. And you can just hear or see in the data too, as those gaps start to close, they are then educated. They can come to us and ask for advice on the next measurement year, or they'll ask, hey, we have this tricky situation and this patient's not falling off. Can you maybe look through this with us and see what's happening here? And we're able to take a look, give some advice, and if it's more clinical, then we are happy to pass off and connect the cardiologist to the provider, either async, e-consult, something that just works around the provider schedule. We know that they're so busy and seeing so many patients, and we just want to make the burden a little lighter. So then we'll just monitor the patient. We'll track and update their records. Like Kate and I were saying earlier, we will follow a patient forever. We'll want to make sure that once their gap is closed, that we're not seeing them again that next measurement year and say, oh, why did Miss Maria miss her medication this year? Let's make sure she gets back on it. Is anything going on? We know that she was able to get her prescription filled, and that she has been great on keeping that medication filled every month. And then we can just do a simple check-in and with a provider that we've created the relationship with, or their care team, and say, hey, Miss Maria popped up again like this year, and we noticed that she had no problems last year, so we're just wanting to make sure everything's okay, and to let you know as well.